Hi, everybody. Welcome. We've got people logging in from Canada and all over the US. Jersey, I was just there speaking, was it two weeks ago? So, first and foremost, I want to thank everyone for being on tonight. I know that, like myself, many of you had a full day of patients or you were hopefully maybe at home with your families, but I'm sure a majority of us were seeing patients today. I know I raced out of the office to be here tonight so I could do this from home. And I take these webinars and anything I teach very seriously because you're giving up your time. It depending, those of you like in Florida, it's maybe past bedtime for some of your children if you have young ones. So I always have a goal when I'm teaching these webinars and or any course that I teach, anything hands-on, anything webinar is I don't want this just to be something where you just hop on to get CE units and nothing is applicable to your daily practice, right? It's always, the times when you've got to travel somewhere or, it's late at night and you take something like this and it's just not applicable and it may be interesting, but that's not what I hope to do for you tonight. What I hope to do for you is give you practical advice based on my experience. And that's all I can do is give you my experience as being a pediatric dentist for a while and, a clinician and someone who's a dental educator. So tonight, the way this webinar started is first we were going to talk about just hygiene materials. We're going to talk about varnish and, some of the actual physical things that we use during our recall exams. And I thought, that may not be the most interesting to people, although it's important to talk about varnish and talk about fluoride, especially what's going on in the news right now. Many of you may be pediatric dentists or dentists that see children. And so what I thought I would do for you is really give you my practical experience of, running a practice and I'll show you my practice here in a little bit and talk about some of the things that I do and my team does to really make our 6-month appointments efficient, right? We get this opportunity to see patients twice a year, mostly, maybe 3 times if hygiene's, but we get this rare opportunity to interact with our patients and deliver the best care possible during that time. And to be frank, we're running businesses as well, right? So one of my mentors always said, Josh, if you are striving and providing the very best care possible, the very, very best that you can do, and then you can make a profit on it, that's even better, right? So I'm going to show you tonight some ways that I do that in my office. I don't have all the answers. I have some of the answers, I think. I do have a fairly good sized practice and a practice that I've grown over the years. So with that being said, if you have questions, please ask me. I teach a lot of these webinars, so I'm a pediatric dentist, so I'm used to being interrupted 27 times a day, or an hour, I should say. And so if you do have a question that's something pertinent, let's go ahead and ask me, and then we'll address it. If not, we'll get it towards the end. So just some of the learning objectives tonight. I really want to give you some experience and some advice on practical workflows for your offices, right? I want to show you, like I said, I don't have all the answers, but I want to show you some of the things that we do in my practice to make sure that number one, like I said, we're delivering the very best care possible. And number two, I want to be efficient and I don't want to stress, right? There's nothing worse than already having a busy day and I can leave home and be stressed. That's okay. I'm the owner of the business. What I don't want to do is have my team stressed out. I'm sure everybody that's on the webinar tonight will agree that it's been harder and harder to find staff, right? It used to be where, I don't know, 10 years ago, I could put something online and we're using faxes maybe by then, and I'd get fax and fax and fax in of dental assistants and all had lots of experience and they didn't want $1 million. And we just don't have that anymore, right? So I want my teams to go home and be not stressed out. What I want to do for you tonight is really spend some time on anticipatory guidance, and we'll talk about what that is. We're going to talk about varnish and why selecting certain varnish can make a big difference in your practice. We're going to talk a little bit about AI caries detection. And then, when we get to the end here, hopefully that we'll have some questions and we'll go from there. Okay. So just some important disclosures for this evening. Number one, I like you all, but I was given an honorarium to be here today. I am 100% transparent in everything that I do when it comes to working with companies. So I work with a lot of dental companies, and the important thing for me is to be 100% transparent. You want to call me after the webinar and ask me what I got paid tonight, I will tell you. You want to know what certain dental companies have paid me for me to go out and speak, I will tell you. I think that is absolutely critical. I'll tell you that Kettenbach has been a great supporter of mine, and I went to Kettenbach, right? I was using their varnish and I said, hey, I'd like to talk about it. And then we formed this relationship. So this wasn't something where they just sent me some material and said, hey, can you talk about this? And we're going to pay you. Again, so I have complete transparency on all the companies that I serve as a key opinion leader for. So it's Kettenbach, it's BioClear, where I have my teaching center, Solventum, New Smile, Pearl, STI, SS White, Dental High Tech, and Trihygienics, and Practice by Numbers and Cable. So, and most of these companies have products that are all different. And most importantly, I do not present or speak about or talk about any products or procedures unless I use them regularly. So if you want to, you can come by my office tomorrow and open up all the drawers. If you don't believe me, you're more than welcome to do it. And you're going to see that all of these companies that are listed there are companies that I use their burrs, or I use their varnish, or I use their AI caries detection, or I use their crowns. I'm very, very careful to keep my validity as a clinician, as an educator. So come on by. And even if you want to just come see the practice, I have people that come by all the time. You're welcome to it. I did not create every slide in this deck. I created most of them. There are some from Kettenbach, and you'll see those mostly at the end. And some are just from, different things. And I do have that written out. Okay. Just quickly about me. So I am a second generation pediatric dentist. That's why my heart goes out to all of you that started practices from the very start, because I was a little bit of a spoiled baby and had a practice from my father. And now I've grown that practice and moved now into my second location since, but I definitely had a leg up. So my heart really goes out to all of you that have started from scratch, and my time is yours. So if I lecture a lot on restorative, more and more I do lecture on practice management, KPIs, metrics, growing a practice, all of those things. We'll talk about some of that tonight. So if you need some advice, if you need some help, reach out to me. I promise I will help you. Okay. So I did my residency at University of Texas, Houston, and I'm actually, after the webinar tonight, I'm hopping on a plane to get back out to Houston to teach a course. I'm also the director of the Dental Specialty Learning Center and the BioClear Pediatric Learning Center. I'll show you some pictures of that. And then, I spend about, I don't know, these days, probably 60% of my time in my practice, and the other 70% of my time teaching. And my wife doesn't like that joke either. Teaching or traveling to speak or teaching courses. Next year, I think I'm in 4 different locations and 13 hands-on courses. And I just finished, got back from Milan. I know life is tough. And so I've been able to really reach out and try to interact with as many pediatric dentists as possible. One of the things I'm very passionate about is microscope dentistry and also intraosseous delivery of local anesthesia. I'll show you another slide, but my contact information is there. So if that QR code on the lower right, if you want to scan that, and it'll send you all my contact details. Okay. And again, those are my contact details there. If you reach out to me, you have a question, you have a follow-up from tonight, you want to know something about varnish, you want to know something about scheduling, reach out to me, text me, email, Facebook. The rule is, if you reach out to me and I don't get back to you in 48 hours, I want you to reach out to me again and say, hey, you're being a jerk, you're ignoring me. I do get multiple messages a day from docs and asking a lot of different things. I will get back to you. So please hound me and bother. No, you're not bothering, but please remind me if you do need something and I didn't get back to you right away. Okay. If you go onto Facebook, I have post all my courses, all my information, everything's on there too. And I'm on Facebook quite a bit. So just a little quick blurb, shameless plug here for my training center. I just got back from Italy there from the training center, and my BioClear training center teaches hands-on restorative. I believe, as far as I know, I'm the only hands-on training center in the world specifically for pediatric dentists. And so we teach how to use composite, how to treat aesthetic cases, peg laterals, making your teeth look like teeth, things that we just don't learn in residency. So if it's something you're interested in, you can scan the QR code there. I book out about 8 months to a year out. So if you're interested, please hop on, and I am announcing dates all the time. We're going to be doing a course hands-on in Minnesota and also 2 in South Carolina this year. So pediatricdds.com is my little shameless plug, and that is my training center. And this is kind of the restorations that I teach, right? So mostly everything that I teach restorative wise is direct hands-on composite. I don't use a lot of crowns in my office. I use some zirconia, maybe a stainless steel here or there. One of the big things that I want to teach is having, especially in the posterior, having teeth look like teeth, having contacts look like natural teeth, placing aesthetic restorations in the interior, and being really proud of your work. So again, it's not the focus of tonight, but these are a lot of the procedures that I teach. And I just passed over 2 years in my new space. So I'm going to be working for a while to pay this thing off, but it's okay. So I moved into 6,000 square feet. We've got 13 ops and an integrated training center here, and just some pictures of my office. So we try to keep everything really light and bright and clean. I didn't go with a theme in this office. Hopefully this will be my last office. And then when I teach courses, we convert everything over into the training center. You can see there a microscope. I do believe that you can use very high magnification, even on 4-year-olds. I use a microscope without a problem. So this is what happens during courses. We convert all the chairs over to hands-on, and it is about as one-to-one as it gets. I bring in a lot of help, and we try to make sure that everybody really is worth their time for being there. Okay, so again, that's my training center, pediatricdds.com. Okay, first resource for you guys tonight. Feel free to take a scan of this QR code. These are all the handouts in my practice that I use for parents on a daily basis. So I just put one up there. That's my over-retained primary teeth handout. I probably have, I don't know, a good 20 handouts that's in that directory, and you are more than welcome. You have my permission to take my name and my logo off and put your own name on there. I do ask if anyone has a good handout that you don't see in my list to send it to me, let me add it to the list, but that is available for all of you guys. And like this over retained baby teeth, I use this many times a day. We email that out to parents. So hopefully it'll be worth your while tonight, just being able to get all my handouts from my practice over 20 years. This is an excellent guide that I put together. This has tons of pediatric dental resources, oral hygiene calendars, SDF guides, fast facts from the APD, useful medications, prescribing radiographs. As I find resources and I find new things, I put those in this directory. So this isn't what I use for parents, but this is just directory that I put together over time. Everything that I discuss and I discussed tonight should be, hopefully, is literature-based. And this is my guide. Our reference manual in pediatric dentistry is thorough and amazing, and I try to stick to it as close as possible. I heard this analogy once, and I think it was at a conference, and I just thought it was so apropos. They said, doing dentistry or performing dentistry for children is like having to be a master mechanic, except the car is moving at 30 miles an hour, right? You see my little friend there. Actually, I had a patient today that looked like that. I wasn't so happy about sealants. But pediatric dentistry can be stressful. Treating children and teens can be stressful. And what I hope to do for you tonight is give you some prescriptive methods of looking at your schedule, looking how you perform your recall exams, and to make your life a little bit easier and make your practice more profitable. All right. So number one here is this. I just picked a random day. I think this is next Wednesday in my office. And this is a normal schedule. This is a 2-doctor schedule in practice. So we have 12, 13, I guess 13 chairs. And some of these blocks, there's no patients yet, but they will get filled in. So we typically see, I don't know, 50 to 70 patients a day. And I do think I run a tight ship. We don't run late very often. I do not like running late. I find if you do, then why do parents ever want to show up on time? So what I'm going to do in these next, I don't know, 5 slides are definitely show you some things that I've come up with over time, or my team members have come up over time, in order to really make our recall process easy and fast and not to rush. Although there's a lot of patients on this schedule, I still feel like I've got plenty of time to talk to parents. And we'll talk about some things tonight on, having parents in the back or not having parents in the back. But I feel like I don't rush. Now we're busy, but if I want to sit and talk about college or talk about, let's see, today we were talking about how many teeth a seal has, which is 34 to 38, or let's see, K-pop demon hunters that we were talking about today. So I still have time to talk about all those things. And, a lot of these, I'm starting to see some second generation kiddos in my practice. And I think there's some things you can do to be efficient in your recall schedule and save yourself time and be profitable. I don't know if anybody on here has realized it has gotten really expensive to run a dental practice. I know every year my office overhead has increased significantly, especially in the last 5 years, and my overall profit margin has decreased. So how do we combat that? Well, we can raise our prices, which you can only do so much, number one. Number two, if you're insurance based, which I just have one insurance that I contact with, but they do fix the fees. And so I can't raise those fees. So how do we stay profitable? Well, we just have to be more efficient. We may have to see more patients. That's okay. We've got to be efficient. And I tell you, this is how I came across Kettenbach and Professional varnish. Was I was placing varnish after the exam on every single one of these patients up on here. This is a dual doctor day, but on a single doctor day, I'm seeing, sorry to get closer to the mic. I'm seeing, I don't know, maybe 50 patients myself on a Friday. We don't do a lot of op. I'm doing a lot of recalls. And it got really old to open that fluoride varnish package and me put the fluoride varnish on every single patient. Some of them, or a lot of them, were not happy because it was sticky and it was opaque. And I tell you what, once I saw, I think I found it through IPEDO, and I think my dear friend Phil Chung had posted about Kettenbach, and I ordered some, and I have not gone back. The number one thing that I want everyone to realize tonight is one of the best attributes of Profeseal is that it is not rosin based and it is basically translucent. So my team can put that on the patient, and while they're doing their hygiene instructions, while they're finishing their prophy, while I'm doing 10 other things, and then I can do my exam and I'm not missing anything. Because there was times before I switched over to Profeseal where I was, they'd forget to put the varnish on, and they're running behind, they put varnish on, and then I'm sitting there with air or cotton rolls or something and try to clean off the teeth, and it's just not an efficient way to do things. Okay, so that's a big suggestion. Just doing that alone, switching your varnish to one that patients like and the taste is good or has no taste at all, and the texture is almost nothing, but that you can see through. That's a win in my book. Okay, so let's talk about just some topics here on things that I do to make our schedule more efficient. Number one is when, thanks to COVID, right, we went paperless. And what happens now, and I'm sure some of you or most of your practices are like this, but maybe not for some of you. So everything we do is paperless. And our medical 6-month updates, where we ask for changes in medical history, we ask if parents have any questions or if there's specific things that they want to address, that gets transferred to the schedule. And we send these out on a tier. So they'll go out, I believe, 3-4 days ahead of time, and then it will continue texting or emailing parents until they click on it and they send that recall note. And what do we do if we don't get the day before? If we don't get that recall update, then we call the parent and we leave a message and say, hey, we didn't hear from you. And if we don't hear by the end of the day, we're going to cancel that appointment and we'll just need to reschedule on a different day. And I don't have a lot of open holes in my schedule. I don't have a lot of failures. And if parents don't get back to us, sorry, we tried. And this is, where we've emailed and text, try to get a hold of them. But that has greatly cut down on the number of no-shows that we have. Okay. The other thing is, whichever system you're using, once my team integrates or updates that medical history in the chart, it automatically gets flagged here on the schedule. So there's, now this is a day in the future, so they're not on here, but there's a little pop-up that shows up on the schedule and they can see immediately who completed their medical histories or not. And so my team knows when they're doing their review a day or two beforehand, they can automatically see whose medical histories have been updated. And if they haven't been updated, they're going to make some calls. And if not, they'll take them off the schedule and they'll put another patient on. This takes a little bit of time, and it takes, I have about 20 employees or so. So this gets to be a little bit more difficult if you have a smaller practice. But my office manager, who was my back clinic lead for many years, or my clinic lead, will review all the charts ahead of time per day. Okay, so she spends a couple minutes. Number one, what does she do? She'll look through the last recall note, and one of the last lines will say what x-rays are due, right? Do they need a pano? Are they due for bite wings? Do they need a PA? And they will make sure that they update the chart. And you can see it says yes there, ortho PAs with a question mark, pano with a question mark. So we automatically know in our morning huddle who's going to need x-rays or not, right? We're not sitting there and having to, and I've been to some practices, even larger practices that work like this. I don't know how they do it, but when the patient gets there, they're looking through the chart, deciding if they need x-rays or not. We are talking about it ahead of time. And if they need to, when we confirm appointments, they're letting parents know, hey, we're taking x-rays this visit. Okay. That also helps us know, because the x-rays may take a little bit more time, on what chairs that those patients are going to go. Now, I have quite a few x-ray heads in my new office. I did that because I was worried about, in the practice I had that was much smaller before this, my location, we didn't have as many x-ray chairs, and that's always a bottleneck. So if you're designing a new office, think about either having nomads. I don't have nomads, I just have standard x-ray heads, but think about making sure that you've got enough x-ray heads in your office. Okay? So my lead will also assign chairs, and some of my chairs in my practice are flat benches. Some of them are dental chairs. And so depending on if they're siblings, depending on the flow of the day, like if we know this says behavior has an F, they know that patient, they're not going to stick in the middle of the recall bay, right? And so that keeps stress level down for everyone. And we also have one assistant assigned per column, and that assistant is in charge of that column. And we make sure when I hire someone, we tell them, listen, you're not just, a random person on the team. These are your patients for the day. You're a licensed provider like I am, and you have a responsibility to take care of all those patients. So they're responsible either that morning, the day before, to go through their column. If they see something that needs to be addressed, you need to ask myself or my associate, they will do so. I have been in some practices where it was just catch and catch can. There was just 5 assistants that day, and anybody just grabbed whichever column. I've tried that, and it just doesn't work as well for me. Now, if one column is running behind, and I'll show you shortly how we communicate that, but if one column is running behind, then we may shift things over, but typically they're responsible for their own column. Okay. So I tend to have one assistant per column, except if I've got a heavy op day, I'm a little bit of a baby. I want 2 assistants in there with me. And so that column 1 is op, and I do have 2 assistants in that first column when needed. Then I also have a floater, and we have the TC, and the TC is the treatment coordinator. Shelby is in charge most days of making sure patients are back on time. If something runs behind, like let's say we had a sealant patient today, behavior is rough, so I need to step in. She's coordinating and getting all those things organized. Let's say all of a sudden the patient's running late and we need to make a decision on where they're going to go. She's in charge of all that. So it's a little bit of I wouldn't say controlled chaos. I think it's organized, but you can see a high volume of patients and practice at a very high level if you have those systems in place. If you don't have these systems in place ahead of time, if you don't do some pre-planning, I find it's chaos, and then you run late. And why do parents ever want to show up on time if you're going to see their child, 5, 10, 15 minutes late? The other thing that we do in my practice is the front desk knows if it's more than 5 minutes, the patient's waiting, they will automatically address that parent, or someone out will come out and talk to them and let them know why. And typically most parents are fine with it, but they just don't want to be left out in the waiting room for 20 minutes without anybody singing. All right. A few other just potpourri items that I find are very helpful. Clinical staff takes a lot of photos. I have intraoral cameras at every single one of our chairs. And someone asked assistants or hygienists. I'm in California, so we have dental assistants, and myself and my associate will do any scaling or any deeper cleaning needs to be done. So my clinical staff knows if they see anything out of the ordinary, pathology, caries, big hole in tooth, something that needs to be discussed with a parent, they're going to grab that intraoral camera out, and it is ready to go. They have they're wiped down, they have sleeves on them, the software is ready to go, and they will take photos. I want all that stuff documented. And I want, if I bring a parent back, instead of all of us sitting there and hunching over that patient and trying to get in with a mirror, I want to see things on the screen. So we take a lot of photos in our office. I do have some of the mouthwatch cameras that are, a few $100s, and they're okay. But if you're going to show caries, if you're going to show something significant, especially the difference between occlusals and sealants, if you don't have a good camera, and I will make a recommendation a little bit later in here, you may want to think about getting a better intraoral camera than one of the mouthwatches. Just for hygiene, general things, it's fine. So assistants know right away they're going to take a photo, especially when one of the operatories patient comes in with pain. They're taking a photo. They will message me, and I'll show you our messaging system here in a minute. And they'll message me, and I may be in my office looking at that photo and the X-ray and saying, okay, this is over retained tooth. We're going to extract it today. They'll have the parent already sign consent. Then I walk in and everything's done. I'll teach you a new term if you don't know this. It's a holer. One of my assistants many years ago came up with this. It's a hole in a molar. So basically, if you have a holer and there is a big carious lesion, like today, I had a kiddo come in just for sealants, but he was a Bruxer and number J, I think he debonded and it was close to pulp. So my team already knows they're going to take a photo and they're going to message myself or my associate, and they will ask right then, do we need to take a film? Okay. I want them figuring all this stuff out ahead of time before I sit down, because if I sit down and then I decide, hey, we need to take x-rays, it's going to slow the whole process down. And the next set of patients that are there may need to get delayed getting into that x-ray room. So I implore my staff to not just clean teeth and quickly go over things. They are to look at every single tooth. And if they see a hole, they see something in the buccal, they see large gross caries, they're going to take a photo and they're going to talk to the TC or message the doctor directly. We use radios as well. And they're going to ask, can I take a film? And most of the time it's yes, unless it's, retained tooth. And so all of that happens before the doctor sits down, right? And like I mentioned earlier, if it's something where I can diagnose just seeing the photo and the x-ray, I may message back, yep, go ahead and do a treatment plan. When I come in, I'm doing my thing, and then I'm out, right? Parents automatically brought back for POH, for poor hygiene. So and I'll discuss when we bring parents back here in just a minute, but if they see poor hygiene, doesn't matter if the child has caries or not, they're going to automatically bring the parent back. Now, for a 15-year-old, maybe not, but for most children, I want parents back. The reason being is we know that you can go over things with a 14-year-old. They're probably not going to listen. Some of them will, but a lot of them will not. So if that parent tells an assistant, no, I don't need to come back initially when they check them in, they will automatically get the parent back. If my team member sees there's significant amount of treatment that needs to be done, if we need to talk about third molars, they will go ahead and prompt already and tell that parent, Dr. Josh may refer oral surgeon today. If we do refer, do you have a preference on who you see? Or they're going to look at the sibling. So they've already figured all of that out, and they've done as much as possible before I come over. And that's really the rule. That's my rule in practice as far as if someone has a constructive criticism or a complaint to one of my team members, the rule is absolutely fine to complain, but I want to know the solution with it. Okay. So they are prepping all those things ahead of time. At every chair, we have, the main referrals for oral surgery or for endo. We have copies of those in every single chair. The other thing that I've done with the main specialists that I work with is I have asked them to make me my own referral sheets, right? So if they're not electronic, if they're on paper, I've said, hey, I refer to you. You want my business? Here's what I need you to do for me. I need you to give me my own referral with my practice name on it. And I want check marks on the main procedures that I'm referring to you, right? So for oral surgeon, I'm not going to have implant consult on there most likely, right? But I am going to have third molars, wisdom teeth, frenectomies. So I want a shorter but more, I should say, more appropriate referral pad just for my practice. So they're not filling out our name. All those little things matter, right? And I want that all streamlined. And trust me, I've not had one of my referring offices or office that I refer to ever say, no, you can't have your own pads, right? Something that and we actually just had a meeting today in my office with my orthodontist is this Bright referral system. I won't go into this, but basically these are just little QR code. I'm sorry, they are what's the near field technology cards The parent just literally taps it. It brings up my orthodontist information. Parent puts their name and email address in. It automatically sends a note to the orthodontist that that patient needs to be seen. The other nice thing that I can do with that is I actually can talk into their phone. I can say, hey, can I have your phone? And I may say, hey, Susie's here. She's super cute. She's 11. I see some impacted maxillary cuspids. I think she's definitely ready for at least a consultation. Can you please reach out to parents? Now, if something really, really detailed, we have a tracking form that we may fill out and have my records coordinator send out. But this is a really nice way of doing things. I have not done this yet for my referring dentist, but it's definitely something I'm looking into. So it's called Bright Referral. It's not very expensive at all. And I think it works quite well. All right. This is one of my favorite things, Blue Note communication system. So I have been using this for, I don't even remember how long, a very long time. And I've searched through a bunch of different pieces of software and I found that this works the best. It is not very expensive. It's like a one-time purchase. They have newer versions, but I found I like this version. So Blue Note, I think it's maybe $600 to $800. But here's how we have it set up in my office. Number one, we use radios. We do use radios for short things. But if you look at all of these 1 through 12, so those are all our chairs, and then doctor's offices, x-ray, and then all of the columns as well. So every single chair and every single column has a space. So you think about this as like a cork board. Okay. Then just by a click of a button, my team, let's say when they're ready for where it says consult there, right? That means it's been 19 seconds and myself or the associate that day is needed. Or the new patients arrived, their paperwork's ready, they're ready to be brought back. They've been waiting 9 minutes. Or column 8, well, the 2 patients in column 8 have been here for 27 seconds. These are seconds, not minutes, by the way. Walkout help. That means that that RDA is running behind and they need someone to come in and help. Or we need the room turned over, or we need the treatment coordinator or RDA needed. But the most important thing is the timer on here. So this will run to 5 minutes and then it'll re-message the office. You can also set this up where there's custom sounds. You can actually import sounds. So I know if I hear the word doctor, I'm needed to a chair. Or if my associate, she's got her own sound, or when new patients are ready. And over time, now we don't have 10,000 sounds, but there's about 10 different sounds and everybody picks them up over time. And I don't have to think about it. I could be talking to a parent. When I hear the word doctor and we don't have it on super loud, I know that I'm waiting for the chair. What I love about this is in just a brief glance, everybody in the practice, all my team members in 6,000 square feet can immediately see exactly who needs what. So if this is blank, it means there's no patients in the office or nobody needs anything, right? But if I start seeing JS needed, JS IT needed, I know I've got to start moving my behind and start seeing some patients. I will also, where it says JS on the way, if I know they've been waiting for a little while and I'm stuck in an op, I may message JS is on the way. It means I'm coming soon. Or if you see that ML 5 minutes, it means I'm running behind an op and I need you to buy me a little bit more time. So communication really is key. So I find between radios and between Blue Note, this has worked out very, very well for me. All right, scheduling efficiency. This is one of my favorite things to talk about. I've done this multiple times in my office. I do this for every associate. Right now, I'm looking for a second associate. If you know anybody that's looking for a job, please let me know in California. But I highly recommend doing this, even if you don't have associates. So this is looking at scheduling efficiency, okay? Because if you think that your sealant appointment really takes 40 minutes, I want you to know I only need to block out 40 minutes for that op. So what do? Anytime, either for me, if I have a new associate in the practice, or if I am doing a new procedure, a different type of procedure, we have this little guide and we write down. So let's say for 2 interproximal posterior primary teeth, right? So if I have a new associate, we're going to write down the scheduled time, the time patient arrives, when we gave, I don't use topical anymore, but when we gave local, when the procedure ended, the time the doctor's out of the room, and the total procedure time. So this is truly not the time it takes the doctor, but how much time you need to block out for that patient. And what I have found is sometimes in my head, the way that I will, ask my team to schedule, let's say, two, I don't really play stainless steel crowns, but two stainless steel crowns. That my head might think that only takes a half an hour. Well, that's not cleanup, that's not turnover, that's not giving a little bit of time if the patient comes late. And so if you do one of these time studies for every single one of your doctors and every single one of the procedures, I promise you, you can increase your production by thousands of dollars a day, because all of us have slop in our schedule. And you really need to know, number one, can you tighten appointments? Can you make them shorter? Or you may be kicking yourself in the foot and running behind every single time and just think, oh, well, you're slow, or the patient came late, or the assistant wasn't that helpful with you. But it may be truly be that the time you think your entire practice needs for that appointment is different. Okay. So, not to beat a dead horse here, but I would highly suggest for yourself and for any new associates in your practice, or anytime you're going to do a new procedure, let's say now you're going to want to do aesthetic dentistry and you don't know how long it takes you. Do one of these time studies. So I'll have my TC or my office manager, they'll just kind of stand in the background with a clipboard and they'll record. And we don't just do it once, they're going to record the same procedure multiple times. So we truly know how we're doing on time for that procedure. Okay. Let's see. I don't have a clock in here. And let me see if I grab my phone because I don't know what time we're at. I've got it here. How are we doing on time? These webinars, I'm just in a room by myself, so I may just talk all day and don't know how long it is. Okay, we're doing great on time. So, parents, I did not come up with this. One of my team members did, and we've been using it for 2 years since I've been in the new office, and I think it's a phenomenal idea. Before we checked in with parents if they wanted to come into the back or not, and I have an open door policy with parents, except if it's for sedation or general anesthesia, I let parents come back for anything, doesn't bother me. Parents often would just come back even with their 14 or 15-year-old because they thought they had to, right? Not because they wanted to, it's just they thought that's what they did. And I'll tell you, a lot of parents, and especially a lot of maybe busy moms that have lots of children, they don't get a lot of breaks during the day. I had a mom tell me last year that sometimes she likes when she has to go to the bathroom for 5 minutes because it's her only time where she doesn't hear the word mommy, mommy 5 times, right? So sometimes our parents want to just have a little bit of mom or dad time and be able to have their child come in the back and be updated at the end. And some parents want to be there for every little thing and sit on top of you during the appointment. So what we do with every single recall patient is when my team member goes out to the waiting room, they will, and before they bring that patient back, they will ask mom, dad, moms, dads, whomever, grandparents, whomever's there, would you like to come back now? Would you like to come back during the exam, or would you like to be updated at the end? That little tiny nugget that one of my team members came up with really has made me feel better as a clinician, to understand, are parents going to, some parents, they just want an update at the end. They don't even want to talk to me. That's fine. Speeds things up for me a little bit. Now my team members will go through everything in detail, and they will always end that conversation with the parent at the end of the appointment in the waiting room. Did you want to speak to a doctor today? But it lets us know early on during the appointment if that parent wants to be there or not. And if mom wants 20, 30 minutes to look through her Facebook, or maybe, actually have a sip of water and just relax a little bit, great. I would love to give parents that option. So unless the doctor specifically wants the parent back, the assistant, they'll do this every single time. But if there are issues, and I mentioned this earlier, poor hygiene, they possibly see caries, something's going on, they will immediately ask for that parent to come back. And that way, when the doctor gets buzzed to come over, they're not sitting there and waiting for that parent who may have gone out to their car to go get something or is on a phone. Okay. That little nugget, I think, is absolutely phenomenal. What we do is in our auto note, we make a note if the doctor talked to the parent that day or not. And I try not to go too many visits without a doctor specifically speaking to the parent, even if they said, oh, just give me an update at the end. And so we mark that. There's a little code that we put in. And so if I see that I have not talked to that parent for maybe, 2 recall cycles, the system will automatically know they're just going to bring the parent back. Now, they may not do it from the very beginning. Towards the end, where they're getting done with the prophy, they're getting done with hygiene instructions, they may ask the TC to bring that parent back. And that way I'm not waiting. Okay. Ooh, take a big break. I'm going to have my diet. So that's orange soda. I'm not opening adult beverage, I promise. Don't tell that I like Diet Orange Soda. Let's talk about anticipatory guidance now. So we're going to kind of go transition off the schedule, but if anybody has questions about the schedule, we can feel free to ask it now. We can go back to it. But I want to talk about anticipatory guidance, right? I want to give some guidelines, and thankfully, I have a dear colleague and friend who's provided her anticipatory guidance guide for all of you that you can download, and I think it's excellent. But I want to give you some guidelines, especially for those of you that are not pediatric dentists or team members, on per age, what do we talk about at each recall visit, right? Because I want to maximize the amount of education that we're giving to those, to those parents and those patients. I let my team members know, that parent may be paying $250, $300 or more for that recall visit. And I don't want to just have my assistant not talk to the parent or the patient and just clean teeth and sit there and buzz me over and sit there and type chart notes while the child's watching a movie and parents on their phone. I want to give them what they deserve, which is the most information possible. And so we use anticipatory guidance for that. Now, this comes from the AAPD reference manual. I think it's excellent. For all of those of you that are pediatric dentists, you'll have access to this. But this is just one of the guides that we use as pediatric dentists to have a good roadmap of what we discuss at every single visit, okay? And I'll show you more detail here. I won't go over this one, but for infants, for 2-year-olds, 2 to 6-year-olds, 6 to 12-year-olds, adolescents. And my team members know, and they have access to all this, what they should be talking about, if appropriate, during each one of these visits. And in general, there's a lot of things that we go over at our 6-month visits, right? It's not just, do you have cavities? How are you brushing and flossing? And do you need to see the orthodontist, or do you have wisdom teeth out? We are doing a lot of things, and I want to make sure that I don't skip any of these things as needed. And I want to make sure that myself and my team members are going over things with parents in detail, and not just, yep, brushing's great. Good job, mom. No cavities in 6 months. I want parents to really know that we checked a lot of things. So I want to thank Amy Adair, who's a dear friend and one of the best pediatric dentists I know. She's a veteran and does a lot of good for pediatric dentistry, especially in the independent dental arena. And so this is Dr. Amy's anticipatory guidance guide. And so if you go to the QR code there, it will you can download this, and we have this in the office. It's laminated, and you go through this with your team members. So so this is birth to 3. What are the things that we talk about? Now, I don't want to go into this in detail because many of you know this already, but you may even want to have this out during that visit for your team member to go over. And there's nothing wrong with that. We have these on the computer. Now, what I do with new patients is I actually have a PDF for all new patients that my team members go through, and it discusses by age all of these things. It talks about when we take x-rays, emergencies, what the doctor's going to do that day, how often we want to see their child, how often how we are reachable during emergencies. I don't want my team to just wing it. I want to have a guide, and so we use that. That's a great idea for your new patients. But if you need to, especially if you have a new assistant, maybe someone that's not been in a pediatric dental office before, or a general office that sees a lot of pediatric patients, have this thing out, and they can I would rather them read off this thing and ask these questions to parents. Again, I'm not going to go into detail here because you guys, again, you can download, that's the QR code. So this goes through, 0 to 3 years of age. What do we talk about? Now, this is a very old picture. This is in my first office. I have a lot more hair in that picture. And at that time, I wasn't wearing long sleeve gowns. I don't know why. But for those of you that are not pediatric dentists, how do you treat a little tiny, now that little tiny baby is not a baby anymore. She's already graduated college. But how do we, and parents will ask, well, how do we assess or treat or clean a little one, right? So this is knee to knee. I still do this to this day. We either have a little pillow or we have a patient bib there, and we instruct parents, to have that child wrapped around and hold hands. The other thing that I do, especially for special needs patients, is I will tell parents, if you feel like you are uncomfortable or your child's uncomfortable, you tell me and let's sit them up. And I find that gives parents control especially if they're new and they're little, they're an overly concerned parent. I find if I give parents the control over pulling the plug and finishing that exam, they will actually let me do more because they know they have some control over the situation, and they feel a little bit more comfortable. Okay. So 3 to 6 years of age, we start taking radiographs, talk about thumb sucking, Mavala, all these things that most of you probably know. But again, have these available for your staff. Download them. Amy made these available to everybody, and it's a great. I'm so glad she did this because I think things get forgotten about. You have a busy practice. This gives you that opportunity to remember what are the main things we're going to talk about. I've seen some people in their auto notes, they may even have age by patient and what are the things we're going to talk about that day. Okay. What radiographs we take, going to the orthodontist. This may talk about, wearing sports guards, when we see ortho, non-nutritive sucking habits, thumb habits, all those type of things. And as we get older, of course, we start talking about wisdom teeth and, exogenous fluoride and healthy eating habits. One of the things I don't have on here that I do discuss quite a bit, just as a tidbit, is if a child does have ADHD, what I've found is, and as I've practiced, I have more and more kids on meds. I do go over that often those kids are not hungry during the day, and I want them to go and maybe make a list of foods that don't cause cavities and have those available at nighttime, because I know a lot of those children wind up eating quite a bit and there's zero stomach throughout them. Okay, this is through our new patient presentation. We go over radiographs. One quick note here. My team members all know that we don't talk about pianos, and we don't talk about bite wings or PAs. We talk about growth and development film. We talk about cavity detecting x-rays. We talk about, x-rays to look for missing teeth or extra teeth, right? That is important that we're using correct terms. And this comes from the APD, and I have this in your folders. One other quick practice management note here, because I got to speed things up. A couple years ago, I realized that, and I have a very high success rate of conversion of parents that I treat and plan to that wind up signing up for treatment. It's 97, 98%. What I noticed is if I use the term baby teeth, when not discussing hygiene or growth and development, but discussing restorative, often that parent, that mom or dad, they'd go home to the other parent and they would say, oh, well, our child has cavities in their baby teeth and they want to have them asleep and fix them. Right? Well, what's that other parent thinking? Well, baby teeth are going to be there till 5 or 6. So what I do now is if I'm discussing again for restorative, I tell that parent, all right, your child has cavities in their primary first molars that are going to exfoliate. They're going to fall out not till 10, or the primary second molars that fall out till 12. And then they go home and they'll discuss that with the other parent, and they have a better expectation of how long those teeth are going to be. We use a lot of disclosing solution in my practice. I would highly recommend, this one's from BioClear, but I would highly recommend that you use disclosing solution in your practice. I have pretty strict rules with my team as far as oral hygiene instruction goes. They know to give out calendars. I'm a big fan, and it's in both the directors that gave you guys these 1 month. This is just a week, but the 1 month brushing calendars. What I like to do with these calendars, I make the kiddos in charge, even at 5. You're in charge of doing your checkoffs, and you ask mom and dad to help. I haven't had a lot of negative feedback from parents, but one of them that's come up several times is they may feel that we are questioning them as parents. If we start out with, well, how's the brushing and flossing for your child? Directly to the parent. Instead, we direct it through the child. Even the child's 4. Are you letting mom and dad help you brush and floss? And a lot of times the parents say, oh, they're not letting me help, blah, blah, blah. We know as providers, we're really asking the parent, are you brushing or flossing? But I find if you do it through the patient, it is less confrontational with the parent. Okay. Photos, I mentioned about photos. This was just a case. I did this yesterday. So as I said, I do have mouthwash cameras in my office, but for restorative, for looking at the difference between sealants and caries, I'd highly suggest, if I don't pull out the DSLR unless it's a case that I'm going to be using as a teaching case or publish. But this is CareStream 1500. It's one of the few cameras that actually has a true camera sensor in it. It's just plug and play. It's USB, but the pictures are phenomenal. I've had cases published in magazines and other things using this camera, not a DSLR. That's one of my favorite materials. We won't talk about that tonight, but this is SDI Stella. It's actually an auto cure composite. That composite was super deep. I think it was, I don't know, some areas 8 millimeters, and you can fill it all up in one shot and it'll auto cure by itself. But I have other webinars on that. And that restoration did not take me very long at all. And I absolutely love that material. It's important to have, good radiographs. I use this example multiple times a day. What I do is I show parents where caries are on the x-ray, then I show them in this example, then I show them caries on the photo, and then we go back to the patient's own x-rays and let them see, and often parents will point things out. I do want to address Pearl for a minute here. This is something I'm uber passionate about. I integrated Pearl in my office 2 years ago. If you go onto Pearl's website, I have a hour-long webinar that I did for them. And I use caries, AI caries detection for every single parent. It's not for patient. I use it, number one, because we all miss stuff. But number two, I use it as a communication tool. If you just show the parent that, shades of gray in the x-ray, they're not going to see that, right? But what they are going to see these colors. And Pearl, if you, there's a QR code on screen. I would highly recommend to at least check it out. I don't get anything by you guys, talking about this, but it's something that I have it integrated in my EagleSoft, and I find this pays for itself in like a day. I think I pay $300 a month. There's no contract, but I really highly suggest that you look at this. It's not the computer doing diagnosis for you. Yes, it'll help you with that, but it is a communication tool. All right. So just quickly about varnish. It's a big deal with caries with children, right? I don't think the general public realizes that tooth decay is the most common chronic childhood disease, right? It's one of the most common reasons why children miss school. When I did my training in Texas, we'd have, kids in a family, 5 children, they all had abscesses and pain, and it's an awful thing, right? And so anything that I can do to eliminate, I wouldn't say eliminate, but to decrease the amount of caries in my practice, I'm going to do so. Right now, I don't have to tell you that varnish is effective. We know that. Everyone's a pediatric dentist or a general dentist that treats children. You know the numbers, right? When you use appropriately, varnish offers a 40 to 56% reduction in caries incidence, right? There's many studies that show that varnish really works. And I want to talk to you just a little bit about the varnish that I use. So again, Kettenbach did not come to me and say, hey, we're going to give you some money and I want you to talk about our varnish. I was using their varnish before I even started doing any speaking for them. I pay whatever the normal price is for varnish. I don't get like free varnish for talking about this tonight. But, unfortunately, these are the caries that we see. Unfortunately, we see rampant caries. And we all know how fluoride works, right? We have that demin, remin cycle. And as that pH changes and the tooth demineralizes, that fluoride ion then incorporates into the tooth, forming fluorapatite. And this is an important thing that we do. It's an important thing that we do. And so there are, many resources on, when we use fluoride to show parents. This is, I think this is in the resource guide. This is one of the things that I use for education. This is from Oregon Health. I thought it was excellent. It's in the directory as well. And it just shows quickly if parents are worried about, can you get varnish on their child? They're worried about that appointment, shows how to do so. But to wrap this up, I wanted to just give you the main reasons why that I choose to use Proficil in my practice. Number one, I mentioned this, it is transparent. So my team can put that Proficil on and I can do my exam afterwards and I can see through it, right? It is dimethicone based. Okay, so many other varnishes are rosin based, and so they are sticky and they are gritty. It never made sense to me is we're sitting there and we're cleaning that patient's teeth and telling them, all right, aren't you happy with how smooth your teeth feels? And I want parents to see how clean they are. And we take crap out of a package that's white and sticky and we put it all over the place. Makes absolutely no sense. With the dimethicone based formulation, it stays on the teeth. It's almost smooth. It's not gritty at all. And it sticks on the teeth, especially if you're doing Curodont. This is one of my favorite. I love using this varnish because I know it's going to stay on the teeth and it's going to help recharge that natural tooth. It is not bitter. It doesn't have, very different. Yeah. So it does not have, It doesn't have a solvent to it, so you don't get that bitterness. And exactly, no alpha alcohol and no resin or no rosin that's there. I know personally, I have like 10 food allergies, and I'm very careful about what we put in our practice. And a very easy application. You don't have to dry. Just remember, the IFUs, you don't technically have to clean the teeth first. Most of us are putting varnish on afterwards, but you don't have to. Okay. Doesn't clog the section lines. That's a big one, right? I trust me, I won't practice before using Proficil. There's more than a few times we had to replace a bunch of lines and do some things or suction because it was filled with varnish. They either have no flavor, very mild flavors, and I find a parent's acceptance rate, especially if I have kids on the spectrum or their sensory issues. And now, their newest version, which is nice, doesn't even cost any more money. I don't know why more people don't buy it. Has calcium and phosphorus in there, and hydroxyapatite. So just Thomas, so everybody knows the IFU here, because people will ask that all the time, is that what do you typically tell offices to tell patients, after they apply it? Eat, not eat.
Well, literature does say that they can eat and drink right away. Best practices, in my opinion, would be to do nothing at all for half an hour. The teeth were just clean, tubules are open, let the fluoride
Correct.
uptake occur. And if they're going to go eat, okay, if they're going to have hot and sticky foods, then they probably should need to know that the fluoride effective won't be as effective because the hot and sticky foods will take the fluoride off. However, half an hour, I think they're good to go.
And Thomas, one important point there is, when my team was putting on varnish at the when I was putting the varnish at the end, the time started ticking at the very, very end of the appointment. But now my team will clean teeth, they'll put the varnish on, and then that half an hour starts. So by the time I'm coming over, I'm doing my exam, I'm talking, we're picking up prizes, they're checking out with the front. They may have burned 15 minutes of that half an hour already. So I don't really, we discussed this, but I don't really worry about it too much because it's just different if you're giving this early on during the. I want to thank everybody. We're going to go over some questions here again. That is a QR code there to get to me. So you'll get my phone number, my cell phone number is on there, my email address. Reach me through Facebook. I'm on there a lot. And if you guys have any practice management questions, if you want to chat about things, please let me know. If I don't have the answer, I probably know somebody that does. I know we had one question about Curodont. I would love to talk to you about Curodont because it's one of my favorite things to talk about, but I would need at least a half an hour here. But I'll tell you, I specifically use Ket box varnish after because of that dimethicone base, and I want it to sit on the teeth. I don't want it to rinse off like water. I use it for every single one of my Curodont patients. And if you want to talk Curodont, call me. I'm happy to talk about it. They're one of my favorite companies. Right. There's one other question that came up. No topical use. That's because I'm giving almost all of my local anesthesia intraosseously. And for intraosseous local anesthesia, you do not need to use topical. Please, if you need something, let me know. Email me. You can find my courses, pediatricdds.com. And I hope everybody has a nice night. Thank you so much.